Hey everybody, I'm Dr. Josh Jagoda, and today I want to talk a little bit about the lunge. And the lunge is a really important type of exercise because it builds a lot of strength in our core as well as our legs and our thighs. So guys, what I see all the time is a lot of people will take a lunge, right? And from this lunge position, what's going to happen is this, right? You see a lot of this happening, right? As you see, the knee starts to get dragged over. And that is really not good for your MCL, your ACL, as well as your meniscus, because you're going to end up tearing it. It's almost like going like this, right? So that's really not good, especially when you have a load, which is your body weight, your hips, your knees all the way out there, and especially if you have dumbbells or things over your shoulder, you start caving in. So the first thing you need to start doing is, whether your foot is going inward or outward, the first thing you need to do is get your foot flat on the ground, okay? Sounds really common, sounds really easy, but guys, it's that simple. Get your foot flat on the ground. Just like your hand is going to grab a basketball, you're going to need as much of that splaying out as possible, like this, right? If you're grabbing a desk or you're doing a yoga position, get your feet to go down onto the floor the best you can. Anchor yourself down. Try to get the knee right over the middle of the ankle. Try not to have it collapse or roll out, right? And then stay in this position. Now, a lot of people, as they squat, or lunge, I should say, they'll drive in. So if that starts to happen, you can get a band, right, that pulls you back this way, or if you're caving in that way, you can get a band that will pull you this way to help that resistance. Now, I don't like to start with the band. I like to start with my feet getting flat on the floor and then trying to get strong dynamically through that position. So what I'll start doing is this, just going down and up, trying to keep that knee in a position, trying to keep my foot engaged, coming down and up and back up. And so this is like almost like a Bulgarian split squat, but guys, it's so important to get your knee to not do this. You are, and guarantee over time, you're going to get some grinding and wearing down of that joint, and you will end up having pain or problems in the future. So guys, get your knee centered over your ankle, get your hips nice and tall, and just squat down. And if you need, or if you can, get a video recording of yourself, or do this in a mirror so that you can see where or how, if your knee is gliding inward or outward, and then you can start to correct that. And of course, you can always use the band, guys. But I see this often, guys. Try to maintain a nice neutral line. Get that hip and that knee over that ankle. All right, guys? I'm Dr. Josh Jagoda. Thanks for stopping by. We'll see you guys next time. Bye.